welcome. Good evening. Namaskar. मैं Dr. देवेश दुबे, FEMA General Secretary. We bring you the new episode of Med Talks, episode number 740. And today we'll discuss more educational, motivational, and so many things we'll give you. So before starting this program, we'll let's see what is the topic. So before going ahead, I would like to introduce our guest. Today we will talk with Dr. Nimesh Ji Desai. Sir is a very famous personality in the field of psychiatry, and he's the ex-director of IBAS. Sir, good evening, sir. Welcome to the show, sir.
Good evening, Deveji. Thank you so much.
Our other guest is Dr. Rahul, who is a SR Psychiatry, PGI Chandigarh. Sir, good evening, sir. Welcome to the show, sir.
Good evening, sir. Good evening, Devesh. Good evening, everyone.
Thank you, sir. Sir, can we start, sir? Shall we start, sir?
Yes, sir.
Yo.
Thank you, sir. Yes. Sir, before starting everything, sir, our topic today, first thing I would like to ask, sir, what is a stigma and how you deal with as a psychiatrist in your practice, sir?
बहुत अच्छा सवाल है. You started with a good question. There can be two levels of response briefly. One, across human history and across the world right now also, if you look at, one thing must be accepted. It's a human tendency to separate out and possibly stigmatize with negative attitudes any person or persons who look or behave differently. Okay, so if you actually introspect, to some extent, separating out people who look or behave differently is a part of the social processes. That's one reality. Over time and over regions, it can keep changing, modifying. Surely, we as medical professionals and psychiatrists particularly would like that stigma which was attached to persons with mental illness should not be there at all. It should be zero. Now, that's the other end of the spectrum. Okay. So, in a sense, the two ends of the spectrum are this. The reality is that psychiatry is a relatively new medical specialty and health discipline. At best, 100 or 120 odd years ago. And so, before that, when people with severe mental illnesses, schizophrenia or bipolar disorder or some others, when they were behaving differently, when the society perceived them as being dangerous to self or people in the society, naturally there was very high stigma. The words madness or lunatic or Hindi mein pagalpan was equated with emerging psychiatry discipline and even psychology. I must say, and I hope Rahul will agree, and both of you and me, people here are the younger generation, which is great, has improved. Can it ever be? I guess open debate. What are the factors contributing to stigma, and how do we improve those situations? I guess matter of time for next 50 minutes to discuss. I'm sure you and Rahul and Jugal Kishore when he joins will have more. I would say that the two of the most stigmatized specialties specialization. And so lepers colonies or places where people with leprosy were housed and people with mental hospitals have always been stigmatized very highly. Besides, tuberculosis and HIV went through stigma and whatever else. But I think the physical appearance and the perception of safety matters. But also realize leprosy also the major issue was, or tuberculosis or HIV, the perception of risk. The risk perception by the other people who believe that they are not affected till now. You know, so besides being normal or abnormal, so-called inverted commas, is the risk perception that determines the stigma to my mind majorly. I'll stop there for now.
Thank you, sir. Thank you for the sir. Next question to sir Rahul sir, आपके लिए sir. As a layman sir, layman person sir, sir, there is something sir कि the person is social mental illness, economic or emotional burden. Sorry sir, sorry to interrupt you sir. I would like to introduce our other guest. Good evening sir, Dr.
Good
Gujal,
evening.
Dr. Jugal Kishore sir, HOD Community Medicine from Safdarjung Hospital sir. Sir, welcome to this show sir.
Namaskar, namaskar.
सर डॉक्टर जुगल किशोर सर आपसे ही क्वेश्चन है सर. सर, person with mental illness is economic or emotional burden on the society, sir?
Yeah, the world thinks so. That is why we have a problem, because we think that he is a, I'm sorry to use the word in literally meaning that this person is inefficient, unintelligent, and he is unable to do anything, and he is a burden on society. And, you know, there are so many words can be given which is prevalent in society. That's the problem. So for me it's different. For the world, that is what I say. Not only in India, but you just go to any part of the world, you'll find that mentally sick person is always taken as that he is not fit for society.
Sir, next question, Dr. Rahul sir, आपसे sir. Sir, every person with a mental illness is pagal, antisocial, harmful to around. So what does it mean? Every person who is suffering from the psychiatric illness is pagal, and pagal term given to who patient?
Like these terms, basically, these have been more used in colloquial context more these days, not just in the literal sense, because we can, in a normal conversation, we end up saying to each other to pagal hai and all those things. As far as psychiatry is concerned or the illness is concerned, most of the mental disorders, as we call them, common mental disorders like depression, anxiety, in those patients, the reality, that reality orientation and everything, that is intact in most of the patients. So they are in the literal sense that those terms that previously the Nimesh sir has said, that uh, pagalpan and all those things, these are mostly used in the context of psychotic patients, schizophrenia and psychotic patients who were not having a literal sense, that they did not have insight, they did not have a reality orientation, they were not in touch with what is going on around, like they were having hallucinations and other things. So, but that is not the case these days. Patients, if that was the previous era, like in the when the patients were being kept in the asylums and chained, when there was no particular treatment, before the antipsychotic era, basically. But now, with the advent of so many treatments, antidepressant, antipsychotics, people don't reach that to that extent that literally they become out of control. These cases are not that common now. So I would say that these things are mostly in, just like that history is progressing, but we are not progressing. Like still we are on the, we surely, this sir also has mentioned that over next 10, 15, 20 years, maybe we'll overcome these stigma barriers. Will and may we may stop using these words. But even now, these imbecile, idiot, these were the previous terms used for intellectually disabled patient. But now, despite being abolished from the books and everywhere, we still end up saying these words to our friends and even in the normal general population so casually.
Next question to Dr. Nimesh sir, sir आपसे sir. Sir, mental illness is like a non-curable chronic illness, sir. Because सर जब भी होता है हम हमें सुना है अब तो ये कभी नहीं ठीक हो पाएगा, आपको लाइफ टाइम हॉस्पिटल जाना पड़ेगा, लाइफ टाइम डॉक्टर के पास जाना पड़ेगा. इज इट राइट सर?
You're asking from me?
Yes, sir, Dr. Nimesh.
ये कहूँ, जैसे
Okay.
टेक टीम ने मुझे सलाह दी है, मैं वीडियो कैमरा ऑफ इसलिए कर रहा हूँ कि शायद मेरा इंटरनेट कनेक्शन स्टेबल नहीं है, तो कम से कम मेरी आवाज आप सब तक पहुंच पाए. सॉरी अबाउट दैट.
Yes, sir.
तो जो आपने देवेश जी पूछा है, टू कंटिन्यू फ्रॉम व्हाट डॉक्टर माय फ्रेंड लॉन्ग टाइम फ्रेंड डॉक्टर जुगल किशोर एंड माय यंग फ्रेंड एंड कोलीग राहुल, they were both saying, and to continue from what I was saying earlier, society, when they find people who look or behave differently, one, two, when they have a risk perception for danger to society or self, and three, like Dr. Guru Kishore was saying, if the person is not going to be productive, that's the history of stigma of psychiatric disorders or persons with mental illness. Unfortunately, as Rahul very correctly said, science has advanced and law has kind of kept pace thoda sa, partly or largely. Social attitudes and societies' attitudes have not kept pace with the advancing science. It can be ascribed to our failure. We psychiatrists or we all medical doctors perhaps fail to get across. And the biggest issue of that is the which aapne raise kiya. I have always, for all the 40 years in psychiatry that I spent with families, with public groups, differentiated between cure and treatment. And with the fullest respect to all my medical and surgical colleagues present here, or healthcare professionals, on behalf of the field that I represent, psychiatry within medicine, I do want to throw this challenge. Except for surgical problems and infections, surgical problems you can claim cure. You remove the appendix, remove the gallbladder. Infections, parasitic infestations, to some extent viral infections, you can say cured. The disease is removed from the root cause and no recurrence or death will happen. Almost all other health problems, despite advances, are only treatable. So the difference between cure and treatment. Now, the claim on behalf of psychiatry and mental health is that mental health problems, including the severe psychotic disorders that my young friend Rahul was talking about, are all as treatable as any other health problem. Unfortunately, the scientific reality we have not been able to get across. So, as Rahul was saying, the old impressions have gone on from generation to generation. I think we need to get across to our medical colleagues, doctor friends, and through them and directly to the public that mental health problems are eminently easily treatable. Second point that you raised, lifetime. Here again, I really would take the liberty of saying that I differentiate in my practice between lifetime and indefinite. While for thyroid hyper or hypothyroid, for hypertension, for diabetes, for most NCDs, the treatment is lifetime. Admittedly, for mental health problems, the science is the treatment is surely indefinite and long term, but at some stage, the treating clinician, the family, the patient can take a collaborative decision and see if the medicines can be tapered off and the person can remain well. Schizophrenia, surely the maintenance therapy can be tapered off. The prophylaxis of bipolar disorder, chronic depression, alcoholism, and so, again, with the fullest respect for medical and surgical disciplines that we are all a part of, psychiatry and mental health, I will politely but assertively say, that science today is able to offer much better and much more solid help than many other medical disciplines. Unfortunately, we have not got this across. And so I'm only using this platform for whoever is with us, our medical doctors, general public, health activists, to try and get this message across. To recap, cure versus treatment and indefinite versus lifetime treatment.
Thank you, sir. Thank you, sir. My next question is to Dr. Jugal Kishore, sir. Sir, there are so many myths present in our society, sir. one myth is there, sir, medicine needs to be continued lifelong. Sir, is it correct, sir?
Yeah, you know, there's a difference between reality and what is going on in the community. That may not be real. Now, the myths are always associated with your belief and religion and custom, culture. Now, according to that, if I say there are such belief because they have experience, or maybe I think as past has suggested, as Rahul has rightly said, that time is changing and the many people are start believing that no, it is not lifelong. Can treat it. Dr. Nimesh has correctly stated that actually we have large number of disorders in medicine also which are like the thyroid or diabetes or they are lifelong. Till your end you are going to take it. Rather, the problem is not that you are taking lifelong or not, you are curable or not, but the stigma associated with this problem is a problem uh, itself. That is why no, we have problem with the psychiatric disorders because the psychiatric disorders are causing more stigma or discrimination as any other illness. But in upper strata of the population, many a time when you go to marriage nowadays they are having the pre-marital counseling and in which they try to see whether this person is going to have or is having the diabetes or hypertension and they don't do. And rather nowadays they are asking about the mental illness also or mental screening. So these are all issues which I personally feel that as society move, I think we have greater role. Although science and what is going on in the society is totally, not matched. That is why that gap is always a problem. Uh, I just want to say, as Rahul was very optimistic, but I'll tell you, even the medical students are not willing to take psychiatry as their profession, and that you can imagine that even our own doctors are not very happy to take up this discipline as a choice. Maybe I think now the percentage is increasing, but the truth is this. So in society, this stigma is quite high, and we require a lot of efforts to decrease or maybe remove it. Yes, Dinesh.
Yes.
Sir, one is in our society, sir, mental health problem are not that common.
What
Will
in
get to
in
tell
our
me.
Sir, actually, the question is, sir, सर कोई भी किसी भी फैमिली में जब सर कोई भी मेंटल हेल्थ या कुछ ऐसा इशू होता है सर, तो दैट विल बी सो पैनिक, ये क्या हो गया, ऐसे कैसे हो गया, अब क्या होगा. तो सर ये मिथ ऐसा क्यों है सर, ड्यू टू द लेस अवेयरनेस इन आवर सोसाइटी, और व्हाट द रीजन बिहाइंड दिस सर?
you are Devesh, you asking me?
Yes sir, yes. How sir?
Okay. The reason, I think the precise reason behind this thought process that ये तो ऐसे कैसे हो गया, ये तो नहीं है, is that every person who goes through this, just like when we are in the undergraduates, when we are the PGs and as senior resident, and as we grow, we think that we have gone through all these process we have gone through. Like we have underwent this stress, we have worked tirelessly, we have faced these situations. So we think that we are the resilient one. Our next generation will also be this much resilient, or they ought to be this much resilient. So that is the problem. We think that we have faced this, so this is a normal situation. So we end up telling our kids, our juniors, ठीक है भाई, ये तो सभी करते हैं, कौन सी नई बात है, हमारे टाइम पे तो इससे भी ज्यादा होता था, हम तो नदी तैर के जाते थे, हम तो पहाड़ कूद के जाते थे. अगर किसी को स्ट्रेस हो रही है, अरे भाई तू क्या स्ट्रेस देख रहा है, हमारे टाइम पे तो ऐसे स्ट्रेस होता है, these kind of dialogues will even hurt the patient or the person who is undergoing some sort of stress even more. But we eventually, we as a parent, we as a senior, we end up saying these things to every person, be it in a training. You can see right, left and center why our residents are uh, end up hurting themselves. This is the reason, because we think that your stress is not that much. We have in our time we have gone through this, so you also go through this. This is not a big deal. This sort of attitude is the problem.
Thank you, sir. Next question, sir. Dr. Nimesh, sir.
Sir, I'm here.
Sir.
Batao ji.
Okay. Sir, next question is for you, sir. Sir, I have done work in IVAS with you under your guidance, sir, and thank you so much for everything, sir. Sir, one case I faced every time in my OPD, sir. Sir, when a patient come and ask me, sir, मेरा दिमाग जब से मैंने दवाइयाँ स्टार्ट की है, मेरा दिमाग काम नहीं कर रहा है, सर. मेरा दिमाग काम करना बंद कर दिया है. तो सर, is medication affect the brain function, sir?
Damn good question, Devesh. Thank you so much for that. Really, a lot of opportunity you're giving us to clarify. But can I take the liberty of connecting what Dr. Rahul was saying in the last part before I come to address this question? These days, we are all very fond of lambasting the social media, especially the WhatsApp University. But having said that, I cannot forget one cartoon that I saw on WhatsApp a few months ago. And this is about what Dr. Rahul was saying about, how people say, why should you feel sad? Come on, get over it, And then you heard the person concerned more, actually. Two ladies sitting on a park bench, one is saying to the other, why are you feeling depressed? Life is so nice, everything is wonderful. Okay. I must try and switch on the video for a minute. So one lady is saying to the other and say, why are you feeling depressed? Life is so good, everything is great. The other lady responds and say, because you are asthmatic, why are you feeling breathless? There is so much of air around. There is plenty of air everywhere. So the similarity is that just like a person with asthma, despite all the oxygen and air available, will feel breathless because of the constriction. A person with depression or any other mental problem will feel what he or she is feeling because of a biological issue going on in the brain. There is no point trying to sermonize. Or if I'm taking to say, पर्पस नहीं है. ज्ञान बांटने से जो व्यक्ति मेंटली से गुजर रहा है उसको मदद नहीं मिलती है, उपदेश से भी मदद नहीं मिलती है. So I'm completely Rahul there. जो आपने बात कही related to the brain function. See, by now we know that not only the severe mental disorders like schizophrenia and bipolar disorder are associated with specific biochemical changes in specific areas of the brain, but even so-called neurotic disorders or adjustment disorders, alcoholism, a lot of mental health problems are associated with biochemical changes in specific areas of the brain. Now, what we do through modern psychopharmacology, 21st century, is we try and alter or correct that chemical imbalance. Okay, deficiency of serotonin, excessive of dopamine, whatever, in specific areas. Now is the major point. Our medical friends will understand easily, but our other general public friends also. Mind is not an organ. Mind is a functional unit, right? Brain is an organ like liver, kidney, or heart. The functional unit mind functions from the brain. So when we try and through medicines and pharmacological agents try and correct that chemical imbalance, there is likely to be some effect on the brain. Like I keep saying to again a lot of my clients and their families and in public meetings, it is as of now almost impossible, although we are much better than we were 30 or 40 years ago, but even today it's almost impossible to completely alter one mental function with no effect on any other area of the brain. Someday, hopefully, we will reach there. But as of now, all psychopharmacological agents are likely to have some minimal side effects related to the brain. Brain being the so-called, simplistic speaking, brain being the hardware, mind being the software. So when you try and do psychopharmacological intervention, there is likely to be some of those side effects. But believe me, I started psychiatry 40 years ago. Today's pharmacology is so much more safe and with less side effects than it was then. And I'm sure by 20, 40, or 50, we'll be better off. In fact, I have a standing joke in the rounds. I don't know, Devesh, if you joined any of the grand rounds, but I've been saying this in grand rounds for donkey's years. Who knows, by 2050, Rahul, you will possibly have an intervention where you have a gun that pierces through the brain skull, goes to the nucleus accumbens, and reduces the dopamine level in one shot. Right? Scientific
Definitely, sir. Definitely.
right? So by that time, people will laugh at us and say, "Pata, ye doctor aise now today the treatment of schizophrenia 2050 might be easier." Science progresses. My friends, the point that I am making is science progresses and the brain basic sciences and pharmacology are constantly progressing. We'll have to function in the existing science of that time. So, which is what I keep saying to my clients and their families, and say, look, in 2020 or 2022, this is the best science that we can offer you. There are some minimal side effects. There will always be some issues of, like you said, sleepiness, drowsiness, some blurring of vision, brain going a little numb, subjective. All zero long-term deficit or I say that with full responsibility. So our friends, medical doctors, please register that psychopharmacology is very, very, very safe.
Thank you, sir. Thank you very much, sir. Sir, next question to Dr. Jugal, sir. Sir, there is one myth in our society, sir. Sir, children and teens don't have a mental problem, sir. Sir, is it true, sir?
Yes, this is true. And now the many studies are coming up. They are saying even the baby born or within a few months, you can find some of the mental disorders. So things are changing. And as Sir has rightly said, that people are understanding that the chemical reaction and secretions of the some transmitters and hormones in the that psychological circuits create problems. So people are as more becoming scientific and learning about the whole psychology. I think they will understand that it is common in everyone, and definitely as you grow and come across with so many environmental and social factors, the occurrence of disease or occurrence of psychiatric problem increases. So, like any physical illness, we have so many factors which can cause. Similarly, psychiatric also, we have so many factors which can give rise to. But in children, the cause may be a little different than the adult one. So it is not true, or say this myth is a myth only. The children are definitely have the psychiatric issues and should be addressed as early as possible, because the effect of these illness is lifelong or can go in a long way. That can become a problem for the child in when he become adult, or the whole family. Therefore, it is requested to all the parents that they should be cautious about all the behavior which they see that it could be, or sometimes it is better to have the consultation with the child psychiatrist.
Next person, Dr. Rahul, sir. Another myth in our society, sir. Sir, our patient day by day encountered with a new problem, sir. by their relative or friends, sir. They told that there is nothing called mental illness, sir. It's a just either act of attention or excuses. There is nothing called psychiatrist illness. It does. And which organ is affected? Where is the your investigation which shows that you are suffering from this disease? Sir? How to deal with this problem, sir?
Well, this is a very common problem. Every patient who is coming to psychiatry OPD must have faced this situation at least once in the lifetime. But just like sir also told that like there is the cure versus treatment sort of part that implies to the psychiatric illnesses as well. If you ask some person where is hypertension, if a patient is having hypertension, if you ask them which organ is having hypertension, can you tell them? We can just tell that there is a higher BP, but which organ is involved? There is no organ involvement. Just like in the psychiatric illnesses also, sir also told, Desai sir told that brain is the hardware and mind is the software. In the same way, we can tell the patients, we end up educating the patient in the same way only on the paradigm of non-communicable diseases. See, and this thing that mental illnesses are only for the attention purpose, this is again sort of a denial mode or a stigmatizing one only. Unless the patient him, most of the times, most of us, even if you are not going to a psychiatrist and you are doing your job well, all of us have faced some or the other sort of problem in our life, stress in our life, while in school, after school, in college, in career, relationships, and everything. But if that problem is causing the dysfunction, that your sleep is not well, you are not able to have food, you are not able to work well, or it is affecting your socio-occupational functioning, your relationships with the family members, then this you cannot say that this is not a problem. And definitely this is a disorder. You have to, thing is again, we have to educate the patient as well as the family members. At times we only think that ठीक है तो normal सी situation है क्या है, and most of the time ठीक भी है कि थोड़ा बहुत stress हुआ, suppose result अच्छा नहीं आया, 2-4 दिन हम उदास रहे, उसके बाद we get back to the part where we are lacking and we end up succeeding. But the problem is that we don't have that sort of awareness. We still think कि मेंटल इलनेस कुछ नहीं है, सब ऐसे ही है, नॉर्मली तो है, थोड़े दिनों में ठीक हो जाएगा, इससे बात कर ले. वी हैव सो मेनी थेरेपिस्ट इन एंड आउट, सो वी आर सराउंडेड बाय द थेरेपिस्ट. हमारे घर में कोई ना कोई होगा जी, मामा फूफा समझा देंगे, कोई बड़े आंटी पड़ोसी समझा देंगे, बेटा कुछ नहीं होता है, हमारे जमाने में तो ये होता था. अगेन आई विल कम टू दिस पॉइंट ओनली. सबको इसी पॉइंट पे आ जाते हैं, अरे भाई ये तो हमारे टाइम पे भी होता था. But no one, unless we tell them specifically that, and as far as that brain and areas, which area is affected, every psychiatric problem has a neurobiological basis now. Though no, even the neurological illnesses, apart from few, like there is a space occupying lesion or an vascular lesion, no other illnesses, nothing is specific in brain. Everything is so interlinked that you cannot specify one part of the brain to one particular psychiatric disorder. So brain is involved, everything is interlinked in brain. If you go for an imaging, you go for an fMRI or any other neuroimaging technique, you will find some of the other sort of problem in the neurobiology. Also you will find lack of dopamine level, increased dopamine level, lack of serotonin if you do the CSF analysis also. So there is a biological basis. We just need to go to the audience. Perhaps we don't educate our general population that well, vis-a-vis the medical personnel, or the sort of advocacy hypertension and diabetes have got for last so many years, for last so many decades. I think if the mental health professionals insist on that sort of advocacy, then we'll end up on the other side. Thank you.
Sir, another question, sir, Dr. Nimesh, sir, आपसे, sir. And very common, sir, for your, sir, young patients, sir. Sir, very common myth in our society, sir. Marriage or childbirth will cure the psychiatric disorder. Has increased the responsibility will cure them, sir. बहुत बोला जाता है शादी करा दो सर.
Yeah, I know. That's very true, देवेश जी. बहुत बहुत अच्छे सवाल आप उठा रहे हो आज. लेकिन मुझे सडनली एक ध्यान आया, मैं प्लीज फ्लैग कर दूं, आने वाले 15-20 मिनट में अगर आपकी आपकी हेल्प से हम लोग वो भी कभी बात कर लें. आज 10 सितंबर इज द वर्ल्ड सुसाइड प्रिवेंशन डे. तो
Today.
आने वाले 20 मिनट में शायद है ना एट सम स्टेज
I think sir connection is lost, sir. Sir, next question to Dr. Jugal sir, आपके लिए है sir. Sir,
Ji.
this is a very common myth, sir. Mental illness is a rich people disorder, sir.
Which disorder?
Sir, only rich people disorder. They are not occurred in poor people.
No. Mental disorders are rather, we can say that it is found in every section of society, because it's a reaction of the mind to various kind of stressors and leading to disorders. So you can find in rich and poor both. But as I'm from a public health, I personally feel what are the reasons, and there are factors which are more common in certain groups, particularly if you see at our slums, or maybe I think in our uh, scheduled caste, scheduled tribes population, where the deprivation, stigma, discrimination, they are quite high. So the possibility of having the mental, disorders supposed to be high, and we have found out that it has effect on not only mind but also whole body and even overall development. So uh, this is absolutely a myth that psychiatric disorders are more in rich. Rather, it is more in people who are deprived of the many resources, which is important for their development, the overall development.
Dr. Nimesh sir.
Can I come in? Sorry. To continue from what Dr. Jugal Kishore was saying, and I'll switch off the camera again.
Yeah.
From what Dr. Jugal Kishore was saying, let me switch gears for a minute. In terms of nutritional status and nutritional disorders, by now it is well known that, especially in transitional societies like ours, while the upper middle class and the rich class will have obesity as a major public health problem, the lower strata will still continue to have chronically malnutrition as a problem. So surely I am with Dr. Jugal Kishore completely that while the basis of genetic and brain disorders will remain similar, the proportion or the manifestation and the type may vary. Secondly, I am totally with Dr. Jugal Kishore also in the thing that he has, I know, researched quite a bit, that economically or socio-economically disadvantaged groups on any number, caste, income. I work a lot with homeless people, as some of you know. Surely, some disorders will be more common as compared to the others, and the job of an egalitarian society should be to see at least those class differences become less, medical disorders or psychiatric disorders. So that's one agenda, surely. But essentially, if the question is, does any group get immunity from psychiatric disorders or mental problems? No.
No.
Like Dr. Jugal Kishore said, no group gets any immunity by whatever criterion. But can I, for a minute, also go back to what Rahul and you were discussing? Rahul, if you and Dr. Jugal Kishore and Devesh and everybody agree, I have a term that I have been using for last few years about what you were saying. Why do people not see mental health problems as health problems or diseases? I think, like we have all been saying, because the pain is in the brain and yet manifestations are behavioral, I prefer the term now biobehavioral disorders. I would like to see all mental health problems as biobehavioral disorders, from alcoholism to schizophrenia to depression to whatever. Your question to me, Devesh, sir, was marriage as therapy. I was saying that my friend Dr. Kishore will agree. It is important to understand the genesis of the public attitudes. How did public attitude come to be whatever it is, right? It's very easy to fall.
Again, the connection is lost, I think.
Next question, sir, Dr. Rahul sir, आपसे है sir. You have encountered with us, sir, one most common problem, sir. All psychotropic medicine are addictive and patient will get dependent on them, sir. Because I have seen many cases in my OPD when I was a non-acad JR in psychiatric department, sir. सर वो मेडिसिन लेना बंद कर देते थे. They become scared कि मैं dependent हो जाऊंगा, इसे जिंदगी भर खानी पड़ेगी. So how to deal with this problem, sir?
Thank you, Devesh. This is the most common question asked in the psychiatric OPD. And again, we have to educate the patients that there is a certain time limit to normalize this disorder, and the various guidelines and expert consensus is there that particular disorder has to be treated for particular duration, like a continuation phase or the maintenance phase, acute phase, continuation phase, and the maintenance phase. We tell the patient if there is he is having a first episode depression or first episode psychosis, like in first episode depression, we tell them that even after coming out of an acute episode, you'll have to continue medications for around 9 months to 1 year. And subsequently, we'll taper off those medications very slowly. Like if a patient is on 20 milligram of acetalogram, we don't end up we escalate the medications very fast, like in 4 days, once a week, but we taper those medications very slowly. Like if we are coming to 20 to 15, we do it after 2 months. In the next follow-up, 12.5, then to 10. That way we can prevent the relapse, prevent the sort of uh, serotonin sort of syndrome that patient feels that they are dependent. These happens most of the medications, only not most of the medications, only benzodiazepines, if they are used in long term, they cause dependence, but again that can be treated. Benzodiazepine dependence management is a different thing, just like other substance disorders like alcohol, uh, opioids and other things. Benzodiazepine dependence also can be treated by decreasing the dose very gradually. So we have to educate the patients that these medications, we don't tell anyone that we are giving you this medication for lifetime. But yes, if you are well for a longer time period, even in the cases of bipolar disorder or any other like chronic schizophrenia, we tell them that if you are well for particular time, like 4 year, 5 years, if you are well, we'll taper off medications, but very gradually. We will not, we don't advise them to stop the medications, or if you stop it suddenly, definitely there are risk of relapse. So that again comes to the education part. When we are prescribing medication, we have to educate the patient, educate the family member how vital is the medication for the maintenance as for the treatment as well as prevention of relapse. That is the key.
Thank you, sir. Really, sir, education and counseling is a much more important role in our treatment. Sir, next question to Dr. Jubal, sir, to you, sir, because this myth is exists in a community, sir. That is why I'm asking to you, sir. People with psychiatric disorders are different from the general population and needed to treat it separately, means far from the community, sir.
No, no, no. They are saying nowadays, as previously also said, that every 1 person in 10, or you can say very common problems are common. The common problems like the anxiety, depression, and OCD. They are very common problem in many of the population. So most of the people. So they are not different. They are similar like us. We can also suffer from mental disorder. It's not that I'm immune from, as we said, rich or poor or whatever. There are certain factors. If it is found in any particular group or maybe person, you will immediately have the sign and symptom and may lead to depression. But there are criteria of diagnosing the mental disorder, which are already defined, and I think they are well established, and it is better to seek help whenever you are going. But no difference at all, except when a person is a psychotic in phase where the behavior is very intense, and in that case, and those people are very less in number. Like only just less than even 0.1% of the population will show such kind of symptom. If all people understand this, that such symptom can occur in certain group which might be suffering from mental disorder. So we cannot say that you know uh, mental disorder person are different from, because among the mental disorder, only 1% of it will have the sign and symptom, which could be abnormal, or maybe you can say a little, which is you can also found in normal person if they are in a feat of anger or in a feat of so you can find at the time of road race, you'll find more symptom than psychiatric patient. So it's, it's not a they are same. It's totally a myth. Yeah.
Dr. Nimesh, sir,
Yes.
sir,
Can you hear me?
sir, I'm going to discuss very sensitive topic nowadays, sir. Sir, psychiatric illness among the young medicos, sir. Actually, it has been seen many, sir. Sir, sir, is audible, sir, for you, sir?
You can ask from Rahul. I think that's better.
Okay. Uh, sir, sir, for you, sir. It has been many cases of unwanted incident happen in different institute nowadays, sir. And day by day, it's increasing, sir. So, what steps should we take to prevent this, sir?
Well, this we all are facing. We all have faced the stress. We have all been going through this process. As soon as we clear our 9th standard exam, we are being told 10th pass kar lo, life set ho jayegi. 12th pass kar lo, life set ho jayegi. Then we are being forced to take 2 years, 1 year, 2 years coaching classes. Sometimes with 11, 12. Sometimes after that 1 year drop. PG NEET clear kar lo, और उससे पहले AI PMT clear कर लो. MBBS. Now in the MBBS also, if as you don't even clear your first year exams, you are being told कि भाई PG की तैयारी शुरू कर दो. You don't make friends. You don't enjoy your college life. You just start preparing for the rat race. That you need a PG entrance. You need to crack a PG entrance exam. We are overburdening ourselves too much. As a as I always advise to my undergraduate friends, that you are here for 4.5 years, or if you do internship 5.5 years, enjoy that college life, make friends. Obviously you are here to study, but you are like other like engineers and all, you are supposed to enjoy the college life also. Things will happen eventually. You'll Even if you start coaching program from first year, you will start after. If you've done your MBBS properly, you don't need 4 5 years of coaching. Problem is there that we are so much being pushed for the PG entrance exam, and that we end up self-stigmatizing ourselves, that if you don't crack INISET, you don't go to AIMS, PGI or any bigger institute, you won't be a good doctor. That is the problem. ठीक है. अब इससे क्या हो रहा है? Because of this problem, there is pressure from family members, pressure from self, and then if you get a seat in your desired or not desired branch, in any branch, residency is tough, and where you have come with so much pressure, and then you are facing patients, you are You are doing almost 24 into 7 work in the departments. Obviously you are end up getting bashed from your seniors or professors. In most of the places they don't mean it, but when you are under stress and you are not at the very sound mind, each and everything will each and everything will hurt you. Whatever your senior, whatever your consultant tells you, it will hurt you. And then if you did not make friends in undergraduates, you don't have someone to talk in PG. And when you're doing post graduation, most of the that is a professional sort of atmosphere. You don't make that sort of friends के यार ठीक है तू एक हफ्ते की छुट्टी पे चला जा मैं तेरा काम कर दूंगा. Sometimes people can do that, but they won't do it again and again. They won't do it always कि तू 2 महीने की sabbatical ले ले भाई मैं तेरा काम कर दूंगा. Someone has to do the work. The problem is there that we are burdening ourselves so much, we are pressurizing ourselves so much that सबको सबको एक ही चीज, सबको बड़ा इंस्टीट्यूट, अच्छा इंस्टीट्यूट चाहिए, सबको एक ड्रीम ब्रांच चाहिए. दैट्स नॉट हाउ इट शुड बी. आप लोगों ने यूजी क्रैक कर लिया भाई, पीजी भी क्रैक कर लोगे. You should not worry what you are at the age of 25 or 30. You should reach, everyone reaches a common platform at 45 50 years. You'll, even if you go for a private practice, even if you go for a government institute, state government or central government, सब लोग बाद में बराबर ही हो जाने हैं. अल्टीमेटली सब फैमिली पे ही फोकस करना है वापस आके. So career ultimately हो जाएगा. If you have cracked NEET and entrance, UG entrance, you will crack PG also. That is no big deal. And if you have cracked PG also, you will be somewhere good only. You are better than 99% of the population of this world. That is a problem, but you just need to, someone has to remind these undergraduates that don't go for a rat race, enjoy your UG life. After selection, enjoy your PG life. That's all. Thank you.
Devesh, I just want to say, add to what Rahul has said. We have many studies showing our medical students have high number of level as compared to any other branch, any other discipline like engineer or social science or other. Even our nursing students or nursing professionals are more stressful as compared to any other. So the medical professionals are under stress, and we recognize it, and just uh, giving the sermon or maybe explaining things is not going to solve. We definitely require a comprehensive program for them, to de-escalate or maybe actually de-stress the whole system which is there. Because every year we are finding our students are committing suicide, and besides that we have a lot of our doctors which are fall into physical symptoms like the depression, this hypertension or other diseases, which are also part of our overall stress. Stress affect everything, everybody knows, but general public do not know that how the stress is affecting our whole system. So we require a comprehensive system in each colleges where there these students can be taken in a much better way. Not only student but also doctors working there. In some region you must be hearing that they're coming for the strike, saying that working hours is extending to 60 hours, 70 hours. That is inhuman. So we have to have some system to cut down the stresses. Hopefully, we can have better life for our fraternity.
True, sir. True. Thank you.
Same question to Sir Dr. Nimesh, sir. It's audible now, sir?
I'm sorry. My apologies to everybody, Devesh, you and everyone, because I got logged out, but I'm on my phone. If I understood the last few minutes well, and I hope it's in continuity, but even if it's not, forgive me. I wanted to highlight on 10th September this day the whole issue of suicide prevention. And all the classical things that we keep saying everywhere is, of course, valid. Recognize depression, take care of suicide rates, management should do, medical college should do. All that is very valid. But let's also face that when all is said and done, the best will come from organizations like FIMA and IMA JDN. I've had the good fortune of knowing some of you, not many of you too well, but I have huge respect for what this generation of young resident doctors are doing at the national collaborative level. Not just that much. There are two concrete ideas that I have, Devesh, you and Dr. Jangra and whoever else. One is that the local RDA or JDA or whatever it's called on every campus need not wait for the management. And having been part of the management, I am saying this with responsibility. Inform the management, take them with you, but start some amount of stress clinic and suicide prevention activities, semi-formally or formally, on your own. Ask the organization for support, space, whatever. My second point, Devesh, will be very useful. And I'm realizing that for the first time, I'm talking about this in the context of medical college education, I think. But 25, 30 odd years ago, when I started working in drug abuse treatment and prevention, I realized that in drug abuse prevention and treatment, later in HIV and later in many what I call biobehavioral problems, there is one consistent finding, my friends. Whenever people have tried with young people in school or colleges at least, any amount of drug abuse prevention or HIV or safe behavior, reduce high risk behavior, they have also done research about when does the message get received best by the recipients. Okay. Now that table of acceptance of the message is always been very consistent, and I say this with a bit of a twinkle. The top of the group about acceptance is always what is called peer counselors. Then come some lay volunteers, then come social workers, then come clinical psychologists, then come psychiatrists, and the professors of psychiatry are the last in terms of acceptance of the message. Okay. So what I'm suggesting, Devesh, for you and your group to consider: one, start having stress management clinic or services, including suicide prevention, on your own with support from management. And two, start the method of peer counselors. See, resident doctors themselves, JRs, SRs, recent resident doctors, if they can be trained to be peer counselors, I think the acceptance by people who are distressed will be much better. And so hopefully the efficacy will also be better. Jugal, does that make sense?
Yes.
Sir?
Very good. Very good. We have already started. Yeah.
Let there be some concrete outcome of today's thing. I will be very happy to work with FIMA, and also now I have a lot more or a little more time on hand, So Dr. Jugal Kishore और हम लोग कुछ मिलके let's do something concrete here, really.
Very good.
My apologies one more time for the loss of connectivity.
Yeah, Devesh.
There are many questions, but due to lack of time, sir, I can't answer. But thank you so much, sir, all of you, for information for the general public as well as for medical, sir. Thank you so much, sir. It's nice meeting you, sir, all of you. Thank you, sir.
Thank you, Devi. Thank you, sir. Thank you, Dasai, sir. Thank you, Jugal.
Good night. It's always so wonderful to be with Jugal on these webinars. We haven't met in person for 3 or 4 years, I think. Thank you. And honestly, big wishes to FIMA. Really.
Yeah. Thank you.
Salute. Bye.